Well, it's 12:02, so why don't we get started? My name is Daryl Gregory. I'm the Executive Director of Caregivers Alberta, and I want to thank you for taking time over your lunch hour to join us for our Lunch and Learn Self-Advocacy in Healthcare. We're very pleased to have joining us today Marj Buerger. Marj is a social worker with the Office of the Alberta Health Advocate, and this conversation is extremely important for each of us, particularly those of us who are caregivers and are advocating for ourselves and our loved ones. Marge is going to help us navigate how to how to advocate in a meaningful, constructive way so we feel like a valued member of the healthcare team and are able to work toward achieving positive health outcomes for those we are caring for. So I'd like to begin with a land acknowledgement first. Caregivers Alberta acknowledges the traditional and ancestral territories of Treaties 4, 6, 7, 8, and 10, namely the Blackfoot Confederacy, Kainai, Piikani, Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, Tsuut'ina, Inuit, and the Métis, which includes 6 regions across Alberta and 8 settlements. We acknowledge as an act of reconciliation the many First Nations, Métis, and Inuit who are visiting or residing in these territories, and the many other First Peoples of Canada whose histories, languages, and cultures continue to enrich our vibrant community. Caregivers Alberta acknowledges these traditional lands upon which we live, work, and thrive. We recognize that all Albertans are treaty people, and it is our responsibility to pursue a deeper understanding of the meaning of the friendship treaties so we can honor and respect the respective view of Indigenous people and you continue to learn our shared history. We also acknowledge the harms and mistakes of the past and invite all to consider how we can each, in our own way, try to move forward in a spirit of reconciliation. In particular, as we strive to offer supports to the many First Nations, Métis, and Inuit caregivers through respectful collaborative efforts. Thank you for that. You would have noticed that this meeting is being recorded. It will be accessible on our YouTube channel by the end of the week. If you need to have directions to find our YouTube channel, perhaps Matt, you can put that in the chat before this meeting is done. And with that, I would like to introduce Marj. As I said, Marj is a social worker with the Office of the Alberta Health Advocates. And she will present a lunch and learn session on self-advocacy in healthcare for older adults. With over a decade of experience in advocacy and a focus on the older adult population, Marj aims to provide valuable insights and education to empower seniors in their healthcare journey. Okay, and with that, I will hand it over to you, Marj.
Well, thank you very much. Can you all hear me? I hope you can. And with that, I'm going to start. Thank you for that nice introduction. I want to let people and folks that are listening to the PowerPoint today or to the presentation, just to know that our office has, this is the self-advocacy in healthcare is something relatively new that we've started. We've been presenting to different seniors groups, primarily in the Edmonton region. We're piloting that program with a lot of success, actually. So it's been actually a really good start for us. And I would like to, be able to share some of our learnings with you. I'm usually, it's more of an interactive presentation, but today you're still going to get the same information, but just not the interactive part. But I'm willing to take questions at any time, and I'm going to check to see if there's questions as we go along. And Matt will share those questions with me if there are any. But first of all, thank you everybody for coming. I appreciate that. And today we're here to explore self-advocacy and particularly in your health, because what we know is nothing is more important than your health in your health journey. Then I'm sorry, I'm losing my train of thought, but we are the the best advocates for ourselves, and working with particular health professionals will help us during our health journey. And we also believe if we get a little bit better at communicating with our health care providers, we have better outcomes for our health. And so that with that, we'll start. Um, oh, the slide is not advancing. Are you able to advance the slide there, Matt?
Not from my end. Did you try using your keypad there? Just using the
I
arrow
did.
pad?
I did, and it's not working. So because when we tried it, it worked. Here, let me see if this works. There we go. Okay, I found a
Awesome.
different way of doing it. So today we're going to talk about who we are, what we do, a little bit about the health charter and how that can help you interact with your health professionals in a different way. It works as a tool, and we're going to talk about what that looks like and how that you can use that as a tool in your healthcare journey. And we're going to talk about becoming a stronger advocate and what that looks like, different communication styles that uh, we see when we're working with seniors and older adults. And as a background, because of the work we do in health advocacy, uh, I worked frontline for many years. So these are ideas and themes that we see from different individuals who interact with our office. So we're not just making this up. We have a long line of listening, coaching, helping individuals navigate the health system. So that's a big role, big part of our role that we do here. But however, we are going to spend most of the time just talking about practical ways about becoming a stronger advocate in your own healthcare. So who are we? The Office of the Alberta Healthcare, Alberta Health Advocates is made up of two parts. We have uh, one part, if you look at it as an umbrella, as a full office, we are the Office of the Alberta Health Advocates, but we do have two portions under that. One is the mental health patient advocate, and that part we're not going to talk about as much today. Those are for folks that are being detained in hospital under formal certificates. So those are folks that we work with, that it's a legislated role, and we work with those folks separately. So when we do the presentation today, we're talking mostly about the health advocate part of the role that we do. We are an arm's length department in the Ministry of Health. Our office values the experiences of Albertans, and we work and promote person-centered practice. So what our office does really well is that person-centered practice. Our main roles are listening, and it's not even about interacting just solely with your doctor today. It's about interacting with all health professionals. It could be your dentist, it could be an x-ray tech, it could be your pharmacist. So this kind of sees you through the plane of all the different health providers that you may interact with. So what we do. So I told you a little bit about the mental health patient advocate. Again, that we just provide rights information for people who are formally detained. And we do have the authority to invest allegations that pertain to rights under the Mental Health Act. And again, we're not going to touch much on that today. But if you want any more information on that, you can always contact our office. And at the end of the presentation will be our contact information. So you can easily get a hold of us. Primarily the health advocates, and this is where we gain a lot of our perspective working with clients. We hear complaints from Albertans about their experiences in the health system, and part of our role is explaining how the health system works. We part of listening and coaching, we do refer people if we're not the right entity that you need to engage with. We can do that soft handoff to different organizations that are in that health ecosystem. We promote an understanding of the health charter, and we have the authority to review when the charter isn't being upheld. And again, we provide coaching on how to be a strong self-advocate. And what makes this office special, together, this office provides a single point of access for Albertans by listening to health service related concerns and assisting Albertans navigate and resolve their issues in the health system. So if you leave here with one thing today, it would be taking our phone number down. I'd like to tell people who are supporting seniors or older adults, and it doesn't even have to be seniors or older adults. It could be other marginalized populations as well. Anybody who needs that assistance. Um, and if you're not sure where to go, what I always try to highlight is if you call our office, we can always direct you to the right entity that can help you. And if it's not us, if it's somebody else, we will help you along that journey. And if you need support along that journey, we can offer that too. So it's a lot of times people are very capable of going on to that next step. And a lot of times there's people that maybe are a little bit less capable, and we can help walk through that where they can phone us back for more advice. Our clients typically, we can have a client for one phone call, or we can have a client for, a few months. So we don't have any time restrictions on when or how we help people. Again, the one thing I want to leave you with is just that you can call our office if there's a concern about your health care. Oh no, now it's not letting me advance again. There we go. But now it's going the wrong way. Okay. Health charter. So we'll talk about the health charter. I don't know if you can see this or not, but when we go out into community and give presentations, we do have a little pamphlet that we offer our older adults or people who are coming to the presentation. It is the Alberta Health Charter, and on the next slide, there will be a list of the different engagements in the health charter that we'll talk about. And the health charter basically outlines the expectations and responsibilities and principles of how you would engage in the health system. And just as a further note, the health charter is in the Alberta Health Act. It's enshrined in our legislation, and it's the guiding document for our work with the Alberta Health Advocates. So when we think about what's our guiding document when we're dealing with Albertans who are engaging with our office, it's the Alberta Health Charter. So I'm going to just go on to the next slide so you can kind of follow along a little bit. So here's the Alberta Health Charter. So at the top, you can see there's three different components. There is the expectations, responsibilities, and principles. And expectations, it outlines what individuals can expect when they're interacting with the health system, including participation in their health decisions, support throughout their health journey, and access to necessary health services. For an example of an expectation under the Alberta Health Charter, an individual can expect to be treated with respect and dignity by their healthcare provider. So that's one of the examples that, and besides that, another example is having access to primary healthcare services. So as you can see at the top, there's many different expectations that you can expect when you're engaging with the health system. And then the second part is responsibilities. What is your responsibility for interacting with the health system? So this details the responsibilities of individuals, health providers, and the health system to ensure effective and respectful interactions. An example of a responsibility under the Alberta Health Charter is that individuals are expected to provide accurate and complete information about their health to their healthcare providers. This helps ensure they receive appropriate and effective care tailored to their needs. So it's about that point is about being honest with your healthcare. So let's say if you're a smoker, it would be important to let your health provider know that. I know as a younger person, when I smoked many, many years ago, I never told my doctor that I smoked. But as an older adult now, that's something I do share now that I used to smoke many years ago. So it's just about your interactions with the health system. Is there any questions on that before I move on?
Yeah, someone was just asking where they can access the Alberta Health Charter.
If you're effective on the computer, all you have to do is Google Alberta Health Charter, and then under images there will be and it's also on our website. So on our last slide there will be our address, our email address, and web address that you can access the Alberta Health Charter. And if you want, we can send one out to you. And we do have these pamphlets that I could send out to the Alberta caregivers, so you have them and hand them out. There's many different ways you can access it, but the easiest would probably being able to access that on your computer.
Yeah, excellent. Thanks, Marj. And I just noticed that one of our coaches, Kareen, did put the link in the chat.
Oh, thank you so much, Kareen. I appreciate that. And when I'm doing a presentation out in the public and when I'm out in community, this is a slide where we talk about in what ways do you advocate for yourself or your family, and and some asking about different experiences that folks have had while dealing with uh, their health providers. And just as an overview, because we have provided about 9 of these presentations in community. Again, this is my first time presenting online, so thank you for your patience in that. It's a little bit different for me, but when we're engaging, a lot of times this is where older adults or seniors or caregivers will share what some of their issues have been in the healthcare system. We have people talking about what we hear a lot in our office, particularly, is if people are going to their doctor's office. Um, we understand that it's not the doctor who's maybe treating them poorly or they don't feel that they're being listened to, but oftentimes it's their frontline staff who take the patients, and we've been hearing a lot of issues with that relationship with the frontline staff and the patient, and and we talk about how to navigate that. And that's just an example. We've had a lot of different examples of where people have kind of hit brick walls and barriers in their treatment. But just know that this is usually a part of so this might be a time where you can just think of, hey, where have I had like a really good experience in my healthcare, and where did an experience not go so well? So there's different ways of looking at it, and it's usually a good way to share. And if that's something that anybody would like to share on chat, if they've had an issue, we could definitely look at that and discuss that. But if not, I will move on. So self-advocacy, and I just want to be really clear, like this is not a definition that we pulled off the internet. This is actually our whole office. There's about 16 of us. We all got together and we talked about what does self-advocacy means from the lens of our office. And by that, we did a bunch of consultations within the office. So if you're wondering where this definition came from, it is from the wisdom of our office and our team. And we're really happy to do it because it does come from the lens of our office specifically. So self-advocacy means speaking up for yourself and taking an active role in your own health. By understanding your needs and communicating them effectively, and using your strengths and learning about the health system and connecting with supports. So often when people call our office, they're hoping to get an advocate in the sense like I need an advocate. But we don't do personal advocacy in the way that people sometimes hope that we do. Um, but what we try to do is teach people how to be the best possible advocate for themselves, because what we know is that people are experts in their own health. No other person is going to be able to understand what you're going through and the complexities of what you might be going through. In our office, we focus on helping people improve their own self-advocacy. So that is a big role. And that's why this is a new role for us going out in public and talking about self-advocacy. We do have a full complement of staff now, so we are able to do more community engagement, which we're really happy to do. And like I said, we've had a lot of success with it. So um, if there's any questions on that self-advocacy point, please let me know. And what we do know for older adults or anybody who's maybe marginalized in any way, effective self-advocacy is crucial because it empowers us to take an active role in our personal health care. We know because research shows it leads to improved health outcomes, greater satisfaction with care, and enhanced quality of life. So we know it's good for you if you're able to speak up for yourself in a way that you feel heard. We know that you have better health outcomes. The next part is, I'll just stop there. Was there any other questions, Matt, that I may have missed?
None that I'm seeing so far, no.
Thank you. So the next part we're going to talk about is communication styles and why we find this important when people are interacting with our office. What we've realized is a lot of folks don't have an awareness or an understanding of how they come across to health providers. For an example, I was working with a client once, and we're going to talk about these different communication styles, the passive, the aggressive, assertive, but she wasn't aware of how she came across. And I'll just give you a little example. When I was speaking with her on the phone, she was really loud. She interrupted. She was rude. And so as the conversation went on, I said to her, like, we had a hard conversation about her communication style, and she was really not aware of how she was coming across. So that's why we highlight the communication styles, because we know that there are better ways to communicate. And so what we'll talk about is um, the communication styles can be broken down into three main groups that we use anyway, and that's passive, that's aggressive, and assertive. So people using the passive communication style often avoid expressing their concerns or needs directly. They may agree with their health care provider without fully understanding what they may need. So when I'm talking to community, uh, there's a certain generation of us that grew up saying, my mom was, for an example, she's a retired nurse, and she always said, listen to the doctor, don't ask what, like, just whatever the doctor says. So there, we have this experience, or my experience, I should say, I shouldn't speak for everybody, um, where maybe at one time in my health journey, or my going, seeing doctors more regularly, is that I learned about my communication style, where I would leave the doctor's office not asking the questions that I should have. So an example of a passive uh, communication style would be, let's say I have a pain in my side and I say to the doctor, "Oh, I have a pain in my side. Oh, but it's no big deal. But I thought I should mention it." So that is a passive kind of communication style. And then we'll just go on to the aggressive. So I kind of spoke about an individual that I had worked with before who had an aggressive communication style. And individuals with more of an aggressive communication style may become confrontational or demanding with their health provider. So instead of um, working with the health provider, you know, they come in guns a-blazing saying, "Doctor, I have this pain in my side and I need you to fix it right now. Right now, I don't have time. You just need to fix it." So that would be kind of an example of an um, aggressive communication style. Ultimately, what we want folks to do and maybe learn is a more assertive. So we know that assertive communicators are better at expressing their needs and their concerns clearly and respectfully. They ask questions, they seek clarity, they engage in open dialogue without being confrontational. So without being passive or the aggressive style, what we're looking at is, so for an example, it would be, "So doctor, I have a pain in my side and I've had it for a while now. It's becoming quite concerning and I'm not sure what to do. And I'd like to discuss possible causes and treatments. And by any way, could this be related to my diabetes, for example?" That would be, and can we look into this today? That would be a more as an example of when you're going to a doctor, it talks about those communication styles that ask more open-ended questions that improve dialogue. Is there any questions on that part? And we know the advantages of good self-advocacy. You have better understanding. Individuals have improved care, increased trust. They're feeling more empowered, and it could possibly lead to any type of early detection of any serious health problems. So we know effective communication is key to achieving the best possible outcomes. Now I should ask, is there any questions, Matt?
Marj, there were a couple comments.
Sure.
So, sorry, Matt. Somebody had mentioned that coming prepared with an agenda or key dates and appointments is helpful.
Yeah,
And
and we're going to actually talk about that in the very
oh,
next
okay,
slide. We're going to talk about it. So thank you for
yeah,
that. And is there another?
yeah.
Uh,
Also a comment about it can be hit or miss with the office staff, the frontline staff. That there are a couple who might be really good, and if this person ends up having to talk to someone else, they ask for the person who they have a good relationship with, who
yeah,
they.
and we're going to talk about that too,
Okay.
leveraging those good relationships, even within an office environment like that. And just as a note, as a side, we are working on, so like, our policy person is working on. Um, it's a toolkit in essence, and on working with doctors' offices from that perspective, like working with the frontline staff on how to educate them to be better communicators with patients from a more empathetic lens, from a more, I like to use like a social worky lens. So
Mhm.
it's not confrontational, where it's actually active listening and trying to solve problems instead of being another barrier for a person trying to get their health care. So self-advocacy, and this is when I'm in person, I ask, are there any strategies that you use, tips and tools for medical appointments? So this is where, if people want to type in, I'll wait a minute, but are there any strategies that you use? Somebody had put already prepare in advance. That's a perfect example of what strategies that we would suggest. But if anybody wants to type some in, I'd be happy to hear what you have to say. And while you're typing that in, I'm not sure if you're the caregivers here are also aware there is a new app. It's an Alberta Health Services app. It's a tool to help folks because a lot of times when we're engaging with community, we get a lot of questions from people who live alone that don't have a lot of supports, and they're oftentimes going to doctor's appointments on their own, and maybe they don't remember everything that the doctor said. They didn't write everything down. They didn't take proper notes. But just know that there is an app now for those folks who are, have mobile smartphones that can work them. That's an assumption, but it is just a tool in the toolkit. It's a smartphone application that allows patients to record conversations with their care team to help reduce the stress of trying to remember everything. And so it's basically it records the conversation and you can play it back at a later date for yourself. Typically, you would ask your clinician or doctor ahead of time if it's okay to record. And the people I've talked with that have used this app said that they've used it with success. I've talked to a couple of people where doctors weren't a fan of being recorded, but once they were aware of what the app was, they were a little bit more uh, agreeable to that. I'm going to see if I can get the chat up too, and then I can. Oh,
There are a couple of new questions that came in there. A couple of comments and a couple of questions. One of the comments saying, take a notebook with questions and write it down, of what the healthcare professional says. It makes
yes,
a real effort to get to know your like doctor's assistant, and doing that leads to no problems. Someone did ask a question though. What is the app called?
it is. And I see somebody else put a note there, but it's called My Care Conversations app, and it's free, and it can record like one of your Lana has said that you can record your health professional and play back at a different time when you're ready to kind of under if you need more clarity or understanding about that conversation. And to kind of expand on that, prepare in advance. Yes, write down any symptoms, questions, or concerns you have before your appointment. Bring a list of your medications, including vitamins, supplements, and update family history if you need to. What we see also um, when we're talking about preparing in advance, when you go to the doctor, a lot of people who engage with doctors and clinicians a lot, when you're going to your family doc, usually they only allow you two issues per appointment. So if you know that you have maybe 3 or 4 or 5 issues, let the staff know when you're phoning to make that appointment that you're going to need a longer appointment. And if they can't accommodate that, maybe they can make a series of 2 appointments for you. So that's really important to know ahead of time that, and if you're not sure how to prioritize that, go with the list of 5 or 6 issues that you're having and help have your family doctor help you prioritize what out of these 6 issues today, what do I need to concentrate on today? And they'll help you with that. So if you're not sure which issue you should communicate about that day, they can help you with that. And we ask people to be punctual and relaxed. Arrive early to your appointment to ensure you have enough time to check in and settle down. Try to relax and remember that the doctor is there to help you. Taking a few deep breaths can ease anxiety that you might feel. And so these are just all little tricks and tips. And another thing that we also encourage is if you don't have that My Care app and you, let's say you forget to write something down. Um, for an example, I went to the doctor with my mom. She is 89 now, and she is a retired nurse, but we went to the appointment, but she has a little bit of hard of hearing. And having another person attend with you sometimes is a really good strategy. I always say it's an extra set of ears if you're comfortable with that. And as an example, we were walking out of my mom's doctor's appointment, and the doctor said to my mom, "Thank you. On your way out, make another appointment for 3 months down the line." And so as soon as we walked out of the office, my mom said to me, "Oh, I wonder, I should ask the doctor when I need to make my next appointment." So those are always, just having that extra set of ears is very helpful as well. And don't hesitate to follow up with your doctor if you forget something. A lot of times our doctors share a lot of information that's the language is something we don't understand. It's okay to ask for clarity. And if you need to talk slower, if there's language barriers or if there's hearing issues, um, you know, it's okay to follow up with your doctors. Even if you leave the doctor's office and you're at home and you're like, oh, I wish I would have asked this follow-up question, it's okay to phone the office and ask for clarification. And even rehearsing going to the doctor is sometimes helpful, especially for those folks that maybe have a lot of anxiety around going to the doctor. Rehearsing, taking a piece of paper, um, and just remember clear thoughts, clear voice, and that helps with uh, that doctor-patient relationship. Is there any, I'm just going to check to see if there's any comments here. It says some healthcare professionals I know are reluctant to be recorded. Yes, there are some that are reluctant to be recorded. That's why I always you may want to ask ahead of time. And if they don't like to be recorded, you can always ask your doctor, you to even share an email with the instructions if you have a hard time retaining that information. Um, and it does say it really depends on the caregiver. It seems confrontational or watchdog-like. No, I agree with that too. And it all depends on how you present it to the healthcare professional or your doctor. Maybe they understand that you don't, that there could be memory lapses, there could be, and if you have that kind of established relationship, they may let you record. But I fully acknowledge that not all clinicians are going to be happy about being recorded. And the comment from Micah, and some of those issues can be related as it's important for your care provider to be aware and able to look at the bigger picture, informing the next plan of action. Great point. And that those are really good. And we're going to talk about some good follow-up and clarifying questions in the next slide. So I just wanted to acknowledge that, though it is a really good practice to say, okay, what are my next steps? And with that, we'll start on with that next slide. Asking the right questions for informed decision making. So we talk about open-ended questions to compare to closed-ended questions, which are yes or no. We don't want yes or no questions. We want if or then type of questions. So part of those asking those informed questions would be questions like, what should I be monitoring or keeping track of regarding this pain? So I have this pain in my side. What is it that I have to monitor? Could this pain be related to my diabetes or some other health issues that I might have? And just like I think it was Micah who said, what are the next steps if this initial treatment doesn't work? Or if you're in the doctor's office asking, what is my next step? When is the next time I see you? What can I expect? Am I seeing a specialist? Like asking all those clarifying questions are really good. And the benefits of those open-ended questions, they prompt your doctor to provide more comprehensive information, which can help you better understand your condition or your treatment options. So those are all really good. And it promotes dialogue with your doctor. The questions foster a two-way conversation, allowing you to share your concerns and experiences while giving your doctor the opportunity to explain in detail and clarify your understanding. Again, just so if you're not sure about what that pain is in the side, could that be my kidneys or can that be my gallbladder? You know, so you're not at a risk for misunderstanding what your symptoms or diagnosis or your treatment. And it empowers us, right? If we're asking open-ended questions, it empowers us to feel more involved and in control of your health care. And for me personally, as I get older too, I'm not going to tell you my age, but I have been working with government for about 26 years now. So I am up there. And I find the older I get, I engage with my doctor differently. And it is about being empowered in your own healthcare, making sure you're on top of it. Because for many years, I really wasn't on top of my healthcare. So just having that opportunity to have that open dialogue allows you that empowerment. And I'm going to see if is there any?
Yeah, there is a question.
Oh,
So
sure.
the question in the chat says, can a patient request copies of specialist or exam reports? Some are not on the My Health app, and we have had doctors tell us no, we cannot see the reports.
Well, my understanding is that you can have access to all of those reports, and there is and there's different ways of getting access to those, and it all depends. Uh, Maybe they are private and confidential, but my understanding, because there is the Health Information Act in Alberta, so it allows you to access your personal information. So if the doctor is telling you that they can't access, I would have them put it in writing why they're not letting you access those reports.
And
And
the additional question there is, are there any grants or supports in place to help with costs of forms?
there's not any grants or supports, but if finances are a hardship and they are for a lot of people, regardless of age, uh, it is up to the doctor. They can reduce those fees because it's fees that they set, even though at the, um, I'm just trying to think of the entity. um, Doctors do set their own fees, but with the Alberta College of Physicians and Surgeons, what I understand is that doctors can waive those fees if it's a hardship or lower the fees um, if you ask. Some doctors may not, but know that you can ask. But as far as grants and supports in place, I'm not aware of any that help with that.
No more questions, Marj.
Okay. Self-advocacy, using your expertise. Just know we are experts of our own bodies, our symptoms, and our situations. Your experience is vitally important. Your experience is vitally important to the success of your treatment. So your self-awareness can lead to stronger self-advocacy and better health because you'll be in tune with your body and your health, which can help with better outcomes and treatment plans. Tap into your own inner strength. We know that we all have strength and we know our bodies better than anybody. I was talking with when I went and was engaging with community, an older adult had shared her journey with cancer, and she shared a story about her knowing her body better than her doctor. And when she went in, she said, my body doesn't feel right. It feels like I'm kind of going through those same stages because she was already cleared for cancer for a few years. And her doctor's like, no, you're fine. It's just, basically said it was, in her head. And but he did agree to do a follow-up session and some exploratory kind of exams and did find out that she was indeed experiencing cancer again. So it was just a good reminder that we are our own experts in our body and not to be afraid to say, my body's not feeling right. It's not feeling the same. And using that self-advocacy. And I'm just going to bring it back for one moment about communicating. We do get a lot of questions, and I'm not sure if anybody's going to talk or ask this question, but a lot of times if people are waiting for surgery times or waiting for specialists, they may be referred to a specialist but haven't heard. Um, the only person in that health ecosystem that can work with you is your family doctor. So as much as like if you engage with our office, so if you came to our office saying, listen, I was referred to my specialist 6 months ago, I haven't heard anything, what we're going to tell you is to engage with your family doctor. They're your ultimate advocate. Um, in that process. Our office can guide you to that, but we would not be able to intervene or intercept in any way how your appointment would be realized. So we know connecting with supports is really important, friends and family, support groups, healthcare organizations. I had talked earlier about leveraging strong connections even with the nurse in the doctor's office. If you have a good rapport with them, um, it is really helpful to leverage those strong connections. And if you know somebody who else knows somebody in the ecosystem that can help or support you, use that leverage. We know the importance of connection is really important. It's essential for boosting mental health, improving quality of life, and increasing feelings of fulfillment. Connection can help people live longer and feel more satisfied with their life. So we know that connection through support groups and other organizations can be very helpful. And I know we talked about this already, but it's worth mentioning again is support during appointments. As I mentioned, my mom is elderly. I do go with her to all her appointments, even though she talks to the doctor. She is ideally the one who's interacting with her doctor, but just having somebody else there for that support is really, really helpful. And so I hope if you as caregivers are offering that support to your family and friends right now, and I know that's much appreciated. Is there any comments on that?
Yeah, there is one in the chat from Debbie, and it says, I find the doctors have less time for patients. They have an assistant talk to you first, then they have to repeat everything again to the doctor. They're doing less tests at the yearly physical. Reason is the tests aren't needed even if they have been done yearly for many years. Hard to advocate for yourself when less is being done.
Yeah, and I think the comment that I can make on that is like, again, asking why. Hey, when I went for my yearly physical, I had this test done. Why isn't it being done this year? And again, I'll use my own personal engagement with the health system. I have a great doctor, and where they used to do a particular test every 3 years, Alberta Health Services now only require it every 5 years. So if there is a concern, maybe you know, uh, there's a long line of, cancer in your family, those are things that you would need to talk to your doctor about. Again, having that communication and just asking why wouldn't we do this? Why wouldn't we do this test again now? Like, what are the reasons why? And having those conversations. And you're right, it is hard to advocate when you feel like less is being done. But I hope some of the strategies that you used today about asking clarifying questions can help you with that. Just, we had this test done last year. Why isn't it being done this year? And see what the question is, and it would promote that dialogue with the doctor. And maybe it's as simple as, we did it, that test is good for 2 years. Um, I hope that answers your question. If it doesn't, please just add a little bit more into the chat box. All right. So if you want to connect with us and connect for supports from our office, we do help with conversations about your specific situation and with health navigation. And what we do really well at our office is listen. Uh, we are not just another office where we're going to refer you on. We kind of pride ourselves on being really good listeners, really good coaches, a soft place for people to land. A lot of times when people are calling our office, it is like their their last resort when they're contacting us. A lot of times people haven't heard of our office, and some of you may have not heard of our office either, but part of us going out into community and doing more community engagement is getting our office out there, our supports out there to support Albertans in their health navigation. Um, so I hope that's helpful. And again, I'm going to leave you with, if you're not sure, just give us a call and we'd be happy to help you have a conversation with anything that you might be uh, having issues with or finding yourself with barriers in your healthcare. So that is the end of the presentation, and I thank you for all your time and attention and for letting me practice on a Zoom format. This is, again, my first time doing this presentation via Zoom, so I appreciate all your patience. And if you have any other further questions, I'd be happy to take them at this time.
Marj, I have a question. It's Daryl
Sure.
here again. So you said this is your first time delivering this presentation online. So do these presentations often take place in person, in community? And if so, how would people find out about that?
So because we just piloted, we started doing these presentations in January, so it's only been about 4 or 5 months. Just connecting with our office and asking for a presentation on self-advocacy. Then they would direct you to me. I'm right now the acting education coordinator, and I set up all those presentations.
Well,
Yeah,
perhaps you and I can have a conversation and we can pull together an in-person
absolutely.
event.
Yeah, absolutely. We would love to do that. Yeah,
Okay.
but we do find that we are doing more online events too, because right now we're kind of just in the Edmonton area piloting. We just accepted a presentation request in Lethbridge during Seniors Week. So we are kind of like now starting to be a little bit more known in the community. So yes, I'd be happy to connect with you about that anytime.
Okay. Matt, do you want to talk about the question in the chat?
Yeah, for sure. So Lizel has a question and it says, can you comment on the lack of availability of mental health support for seniors in acute care hospital? Even waiting for long-term placement, seniors are navigating very difficult life transitions, and I'm finding there is no mental health support for this. Any suggestions for support?
I just want to first acknowledge, yes, it is a tough road for a lot of folks. And we see it in our office because when there are seniors who are dealing with mental health, a lot of times they will be um, formal become formalized patients under the Mental Health Act, which it was one of our roles that I kind of talked about. So we do see a crossover of people with that lack of support. As far as connecting with other supports outside a hospital, it would be talking to the doctor, what they offer in those hospitals. We know that there is lack of supports in some jurisdictions for mental health for all ages, not just seniors. And I know that the government is doing their very best right now to address those issues. But off the top of my head, there's not like a place where I can say, here, you can call here. If they're in community, there's a little bit more. But if they're in hospital waiting for placement, where we see a lot of hiccups for those folks is finding that appropriate placement, because there's not a lot. If, let's say, you're severely mentally ill and you're elderly, there might only be a few appropriate housing spots for you or long-term care spots. So you may have to wait longer in hospital. Um, that's about all that I can comment on this time. And I know it's very difficult to navigate, but again, if this is a certain circumstance and you want to talk to somebody about it, call our office and we can definitely at least uh, talk more in length about what you could ask, the transitional, like there's usually a transition team that works with seniors who are waiting for long-term placement, and maybe it's about asking the right questions there so we can, on an individual basis, help with that.
Mhm.
And again, um, I'll just leave it there.
Yeah. Not really a question, but more of a comment, Marge. I think that especially from the caregiver point of view, um, this proactive approach to getting the most out of our time with our healthcare professionals pays a benefit in that it helps keep the care recipient at home and out of hospital potentially,
Yes.
because we're providing that proactive care and developing a plan and all of that. Would you agree?
I would agree with that. And we know that uh, everything that we talked about today, we know works because we've engaged with not research shows it, um, even working and hearing from experiences of people that we work with on the daily, we know that proper engagement does work and does keep people out of hospitals. Um, and I know it firsthand working with my elderly mother too, that, these are things that work. And even in my own healthcare.
Hmm. Yeah. Just somebody put in the chat that Red Deer could use you, Marge. So do you actually take this on the road?
Yes, well, like I said, we were piloting this kind of presentation, and we've had a lot of great feedback and a
Yeah.
lot of success out in community, especially with a lot of seniors who may not otherwise get to engage in this way. Um, so yes, we do take the show on the road, and we can also offer it online if that's an option too. Like I said, we just accepted during Seniors Week, we're going to travel down to Lethbridge, and
Okay.
yeah.
Yeah. Yeah. Yeah. Lana, one of our coaches is, oh no, no, she's in Medicine Hat. I keep forgetting that, Lana, and she's on this meeting as well. Yeah. I don't see any other questions in the chat. So yeah, again, uh, you can access this video on our YouTube channel, and Matt put the link to that channel in the chat earlier, and it should be up there by the end of the week. So, Marge, I want to thank you for taking the time. This is an important conversation, an important topic. So, yeah, I think I know I got a tremendous amount of good information out of it,
Oh,
and
good.
I'm
I'm really
hoping that we
glad.
can, yeah,
And it is it's a presentation in progress, so we take our learnings and apply it
yeah,
to the our next. So I appreciate everybody's time, and if you have any questions, please contact the Office of the Alberta Health Advocates.
excellent. Thanks so much, Marge, and thank you to everybody who joined.
All right,
Bye-bye.
bye-bye.